We probably all know someone who's been touched by cancer. Coming up on At Issue, we'll talk about a nationwide study that will have regional and local impact. Our guest is Dr. Abdur Shakir, Director of the Regional Cancer Center at Sarah Bush Lincoln Health System. Stay tuned, At Issue starts right now. According to the American Cancer Society, more than 1 million people in the United States get cancer each year. Cancer remains the second most common cause of death in the U.S., accounting for nearly 1 in every 4 deaths. In an effort to better understand and help prevent cancer, a new study is being launched nationwide. The study will include area hospitals and people as well. Joining me today in the studio to talk about this is Dr. Abdur Shakir. Thank you for joining us.
Thank you for having me.
You've been on our Being Well program a couple of times, so I know our viewers are familiar with you. But today we're talking about cancer. Let's talk about cancer nationwide. What of the cancers remains the #1 cause of death?
Great. Thank you again for having me at the program. When we look at cancer nationwide, especially for men, the 3 most common cancers that we see are prostate cancer, which occurs in about 220,000 cases per year, lung cancer, which occurs in about 100,000 cases per year, and then colon cancer, which occurs about 50,000 cases per year. When we look at women, we see breast cancer, which occurs about 230,000 cases per year, lung cancer, which occurs about 90 to 100,000 cases per year, and colon cancer, which occurs about 45 to 50,000 cases per year. But that's not the most important question. The most important question that we see is how many people die from cancer. So if we look at men in general, more men die from lung cancer than colon cancer, pancreas cancer, and prostate cancer combined per year. More women die of lung cancer than breast cancer and colon cancer combined per year. So that's a serious epidemic that we're dealing with as oncologists as well as patients, and we have to do a better job.
And it surprises me because of all the, the decrease in, people smoking, and you can't smoke here, and cigarette prices have gone, all the things that have, encouraged people to quit smoking, yet lung cancer is still the #1.
Correct, and the difficulty with lung cancer is about 70% of cases are found in the advanced stage setting, so we have to do a better job of finding them in an earlier stage.
Now, are those lung cancer patients maybe older patients that probably started smoking, 30, 40 years ago and just never quit? Are you seeing that they're more your older patients?
Correct. So the average age of diagnosis of lung cancer is 65. So most patients are those patients that were 40 years ago, it was the norm to smoke.
Right.
So it's not uncommon to see these patients now come to fruition, and we see the risk of cancer developing in them.
So because maybe there's less 40-year-olds, 30 and 40-year-olds smoking now, do you see lung cancer decreasing in the next
Well, we
10
hope
years?
so. If we look at least some of the cancer-related statistics from 2008, we can see a slow decrease in the rate of cancer. It has decreased in men, fortunately, but unfortunately, it really hasn't decreased in women. A lot of the ad campaigns have been geared towards men, but we also have to make the push towards women to stop smoking as well.
Let's talk about locally in our area here in East Central Illinois. Are those cancer types still, do they correlate nationally to locally?
Good question. If we just look at the state of Illinois compared to other states, if we look at about 100,000 people, we average about 470 cases of cancer per that 100,000. If we compare that, for example, to New York or Connecticut or Massachusetts, the Northeast region, they have about 500 cases of cancer per 100,000 people. Illinois is not the highest, but it's for sure not the lowest either. But if we look at specific cancers in the state of Illinois, there's 3 that I want to point out. Lung cancer. If we look at lung cancer, for every 100,000 people, we have 70 people being diagnosed. If we compare that to Mississippi, if we compare that to Tennessee or Missouri, those southern states, they have about 90 cases per 100,000. So one would say they're probably smoking more in those southern states compared to Illinois. But if we compare colon cancer rates from Illinois to other states, we see there's about 50 cases per 100,000 of colon cancer that's found in the state of Illinois. If we compare that to Arizona or New Mexico, they have about 30 cases per 100,000 of colon cancer. If we extrapolate that, we could say in the Midwest, we eat a lot more red meat. We have less fresh fruits and vegetables. Chicago is the meat packing industry. So we could make that assumption as based on our dietary factor. If we look at skin cancer in the state of Illinois, we have about 7 to 10 cases per 100,000, but if we compare that to Florida or Arizona or the state of Washington, they have about 30 cases per 100,000. So we could make the case of environment. There's more sun exposure there than in the state of Illinois.
And I was surprised that I looked up this American Cancer Society study and what causes of death from cancer in Illinois. As you said, lung is number 1, colon is 2, and pancreatic cancer is number 3.
Correct. So part of these studies that we want to talk about is to determine the cause. So the first question a patient usually comes and asks me is why? And a lot of the times I'm not able to give a reason. So we're hoping with some of these prevention studies we're able to determine causes, and then I'm able to give a person why this cancer developed.
So let's talk about, how long has cancer been researched since when? The 1930s, 1940s?
Correct.
When did they really start doing serious cancer research?
So the statistics of cancer really hasn't started till 1930. So since 1930 onward, that's where the statistics of cancer in the United States has least come about. If we're just looking at the statistics of cancer, we can see there's been some changes. Some cancers have increased and some cancers have decreased throughout the number of years. If we're looking at the cancers that have increased over the last 70 to 100 years, there's really 4 cancers that have actually increased over the last 20 years. And those 4 have been really detailed out from the American Cancer Society as well as something called the SEER epidemiologic data. Those 4 cancers, the first one is oral pharyngeal cancer. The oral pharyngeal cancer, better known as mouth cancer or throat cancer, has been really linked to smoking and alcohol. But over the last 15 to 20 years, we've realized that it's also been associated with a virus called human papillomavirus.
Oh, really?
So that human papillomavirus is notorious to cause cervical cancer, but now we're also seeing it as a causative factor for oral pharyngeal cancer. So we have to do a better job of promoting not just HPV vaccinations for young women, but also for young men as well. The second cancer that's been increasing over the last 15 to 20 years is esophageal cancer. We've seen this particularly in Caucasians and Hispanics, and that increase in esophageal cancer can be correlated with the increasing weight of the Americans as well as the increasing waist size of the Americans.
Really? See, I would have thought it had something to do with tobacco use.
Not necessarily tobacco, that's the actually increasing weight. So if you look at some of the studies, what can cause esophageal cancer, one study points out that patients that have a body mass index of more than 30 have a 16 times more increased risk of developing esophageal cancer. So clearly a risk factor has developed, and this has been developed from previous American Cancer Society studies. The third cancer is actually melanoma, which has been increasing over the last 15 years. The 2 groups that are really affected at this moment are men that are more than 70 and patients that are less than 30. So men that are more than 70, we have a clear reason why. Those men that are more than 70 were usually during wartime when they were younger. There was never advocated for sunblock or sunscreen.
Right.
So we've seen some of the factors now come about at the age of 70 of their risk for developing melanoma. But what's more important is those patients that are less than 30. So if we look at the International Cancer Research Organization, they have really come out and said tanning beds. So if you look at specifically tanning beds, there's about a 75% increase of developing skin cancer simply from tanning beds alone. So we need to do a better job of educating our patients that are less than 30 about the risk factors associated with tanning beds. The last cancer that's been increasing over the last 15 years is thyroid cancer. There's been about a 140% increase in thyroid cancer since 1970 till 2008. Now, for oral pharyngeal cancer, we have HPV. For esophageal cancer, we have weight. For melanoma, we could say tanning beds. But unfortunately, for thyroid cancer, there's no real good reason why there's an increase. And that's why some of these preventative studies will hopefully give us some more information.
And we're going to be talking about that preventative study that's going to be including people from our region in just a little bit. But what I wanted to ask is, what types of cancer, I don't know how many years you want to go back, maybe 10, 15, 20 years ago, that were considered, I don't know, for lack of a better word, a death sentence, that now today with advances in treatment, people can actually live from and be cured of?
Good. So if we go back actually to 1930s when the first statistics developed, what you saw back then was about, for every 100,000 people, 45 to 50 would die of stomach cancer. That was the #1 killer. Now, for men and women, if we fast forward to 2010, the rate of death from stomach cancer is about 8 to 10 out of 100,000. So from 45 to 50 down to 8 to 10 out of 100,000. So a dramatic difference. And that dramatic difference has likely to do with our diet habits. Back in the 1930s, there was not a refrigerator, a lot more preservation of foods, using something called nitrites or chemicals to preserve food, which increases rate of stomach cancer. So we can see the reasons why there's been a decrease. The second cancer is uterine and cervical cancer. From the 1940s, there was the advent of the pap smear. So we've seen about an 80% decrease in cervical cancer deaths from the 1930s now to the 2000s. There are some other cancers that have been decreasing and the increased rates of response, and that's particularly leukemias. If we look at children, acute lymphoblastic leukemia was a difficult cancer to treat in the 1940s, and about 50% of patients would ultimately die from this cancer. If we fast forward to today, about 90% of patients do quite well, so dramatic differences.
And are we unfortunately still finding, or are new cancers developing, real maybe rare or odd types that aren't affected by a lot of people?
Not that there's necessarily new cancers that are developing. What we are seeing is the cancers that were not as common starting to become a little bit more common. What we also are seeing is more cancer survivors. So we end up having more patients, which is ultimately good, is because we're doing a better job on just treating cancer patients.
Okay. Well, let's talk a little bit about how cancer research works. In the U.S., where is the most prominent cancer research taking place? Who does it?
Sure. The National Institute of Health and the National Cancer Institute are two major organizations that are closely working with developing treatments, not necessarily just for cure of cancer, but also control of cancer. Even if we cannot go out and cure a cancer patient, what we like to do is make cancer a chronic issue, like you would high blood pressure, like you would cholesterol, like you would diabetes. So these organizations are doing some dramatic advances, and we've seen that come to fruition over the last 20 years.
You're an oncologist with Sarah Bush, so you treat cancer patients. How has cancer treatment changed in the last 20 years?
So if we just look at the advances in cancer over the last 20 years, there's really two separate areas I'd like to focus on. The first one is preventative, and the next one is treatment. If we just look at the prevention of cancer, we've done a remarkable job. For example, women between the ages of 40 to 49 that undergo screening mammogram have a 29% decreased risk of breast cancer death by those screening mammograms. If we look at patients that are 50 and above undergoing screening colonoscopies and happen to have a polyp removed, you have a 53% reduction of colon cancer death. If we look at pap smears, 80% reduction of cervical cancer death. Now, as we mentioned in the beginning, lung cancer is a big issue. So at Sarah Bush, at Sarah Bush Lincoln, our cancer center is really on the forefront of developing something called lung cancer screening. This has developed at major tertiary cancer centers over the last 1 to 2 years. There is a study that shows patients between the age of 55 and 74 that are smoking for at least 30 years or 30 pack years, that's 1 pack a day for 30 years, if they go under low dose CAT scans, they can decrease their risk of lung cancer death by 20%. And that's one of the first studies that have shown that. Now, I don't want patients to take this as, okay, I can smoke and I can just go get a CAT scan. No, the still best preventative measure for lung cancer is stop smoking. Now, if we switch to therapeutics or treatment options for patients in regards to cancer research, what we see is surgery, radiation, and chemotherapy have all made their advances. In regards to surgery, what we see now is the surgery, less of an operating room time, less of a recovery, a less invasive surgery, meaning mastectomies have now changed over to lumpectomies. And now the development of something called robotic surgeries. So you may have a robotic pancreas cancer that's removed, or robotic prostate cancer that's removed, and now robotic lung cancers that are being able to remove. So surgery has made some drastic improvements of improving the quality of the patients so they can get to their second type or third type of treatment like radiation and chemotherapy. If we look at radiation, back about 20 years ago, what we did see was a little bit more of an archaic form of radiation. The radiation beams would hit the cancer, but unfortunately unfortunately would cause a lot of collateral damage to other organs. What we have at the Sarah Bush Lincoln Cancer Center is something called intensity modulated radiation therapy, which is the most sophisticated form of radiation therapy at the moment. We use computer generated linear accelerators which target the cancer in a 3D format. So what that does is that you're hitting the cancer directly and less affect the collateral tissues like other organs. What's also been huge in radiation is the development of something called gamma knife surgery or stereotactic radiosurgery. So for those patients that are too unwell to undergo surgery, you may be able to treat or cure their cancer with a beam of radiation directly targeted against their cancer. This has developed over the last 10 years or so. Now, this may be my bias, but chemotherapy has made the biggest advances, I think, over the last 25 years. Not just chemotherapy, but chemotherapy supportive issues. So about 15 to 20 years ago, a lot of patients would have significant nausea, significant vomiting, and a higher risk of infection. What we've developed these days is sophisticated, precise anti-nausea medications, so those patients don't have to undergo severe nausea. We've also developed something called growth factor stimulators. These growth factor stimulators stimulate a white blood cell so they don't go too low. The risk of infection is less with these patients. Now, since 2000 till now, what we see is this something called targeted chemotherapy. So 20 years ago, the shotgun approach to chemotherapy is that the chemotherapy kills all cancer cells and kills everything as well. But targeted chemotherapy has really revolutionized the way we see cancer. There's a switch that's turned on in the cancer, and we can switch that switch off with that targeted chemotherapy. So those advancements have been dramatic. So this advances in cancer research, so all this money being spent in all these preventative studies, we've seen the improvement. So if we look at 1970, the 5-year overall survival for cancer was 49%. So out of all cancers, 49% of patients would be living. Now, if we fast forward to 2008, we're looking at about 69 to 70%. So about a 20% improvement over the last 25 to 30 years just with these advances.
Wow. Well, let's talk about this cancer study that the American Cancer Society is starting, or they're looking for people. And this is a nationwide study, but also people regionally in our area, all of our area hospitals are taking part in it. Tell us a little bit about the study and how long it's been around.
Sure. So this study is looking for 300,000 participants. It started in 2007. They have about 120,000 participants already. They're really looking at patients between the ages of 30 and 65. They would be required to fill out a brief questionnaire, give samples of blood, get a waist measurement, and then agree to follow up for at least the next 20 years or so. The importance of this study is that you're able to assess a person's environmental risk factors, lifestyle risk factors, genetic factors, and then we can determine causes of cancer and preventative measures of cancer. A preface to this study was was the Cancer Prevention Study 2, which actually looked at 1 million participants, and from these 1 million participants, we've had over 300 scientific journals being published in relation to lifestyle, genetics, environment, and cancer. And one of the biggest ones is obesity and cancer, and that was published in 2003.
So I was going to say, what are some other things that have come out? So this is the third one. What other breakthrough things came out of the first and the second one? The
biggest one has been obesity and some of the lifestyle factors. But if we go back just with the American Cancer Society in general, in 1948, the American Cancer Society had one of the first researchers develop the chemotherapy protocol for acute lymphoblastic leukemia, which made dramatic differences in these patients. In 1970, the American Cancer Society established something called the Hope Lodge, which is a lodge for cancer patients that if they're traveling a far distance, they can stay at this free lodge. In 2000, the American Cancer Society was part of development of targeted therapy for something called chronic myeloid leukemia, which is a bone marrow leukemia, which prior to 2000, these patients would undergo high-dose chemotherapy, bone marrow transplantation, and about 50% of them would survive. In 2000, one of the American Cancer Society researchers actually found the switch that's turned on in this leukemia, and now 90 to 95% of these patients can be cured or treated with just a pill alone. And in 2012, the studies have really come about that the 20% decrease in cancer has been related to the changes of environment and lifestyle. So the American Cancer Society has done a lot of research, at least for the last 100 years, because they were founded originally in 1913.
So how often do they, this is the third one, how often do these studies come up? Because is the first one still going on? Are they all 20-year studies with this group of people?
The second and the first ones are done, so they've collected their data and they've come out with some causative factors. The reason why we're doing the 30 to 65 age group is we're trying to track how can we prevent those cancers, because most cancers happen 60 years plus. When we just look at the data in general, if a person is 60 years old, they have about a 15% chance of developing cancer in the next 10 years. If you're 30 years old, you have about a 1% chance of getting cancer in the next 10 years. So we're trying to figure out how do we change a person's lifestyle and behavior at the age of 30 so they don't have an issue at the age of 60.
So is this study, this is not like being part of a clinical trial, so you're not going into a lab and being poked and prodded for the next 20 years?
No, absolutely not. This is what I see for patients as, or our participants, is giving something back. We all know somebody with cancer. We either have a relative, a spouse, a child, a friend, a neighbor with cancer. So this trial doesn't get you involved metaphorically or figuratively, but it actually gets you involved literally. You're doing something to help the better good of these cancer patients.
So what are they hoping to, I think when we talked before we started taping, correlations between, I think you said lifestyle and cancer, is that more of what this study is looking at?
The reason why we do cancer epidemiology is not just to come out with numbers, so I can say 53% decrease, 20% decrease. It's really to associate causative factors. So what you're trying to do is, with an X group of people that have a certain lifestyle, you can then determine what causes their cancer. You make the leap of faith of then making preventative measures. You then make the leap of faith of making treatment choices. So we can see what's happened over the last 20 years with the improvements of prevention, with the improvements of lifestyle changes. So as a patient or as a participant in this trial, what you like to accomplish is you're able to develop those risk factors for the future generations, or even the generation of now, is how do we prevent cancers in the future.
So how will this work? If someone, you know, in our region is watching and they want to be part of it, how do they get involved?
Sure. So there's 5 locations in Central Illinois. One is at our Sarah Bush. The Lifestyle Center has the Cancer Prevention Study 3. Carl Clinic in Champaign, Christie Clinic in Champaign, Effingham, and Danville are all participating in this cancer prevention study. But if someone would like to know some more information, I suggest they call the American Cancer Society. That's 1-888-604-5888. And they can give some more information about the cancer prevention study.
So you're committed to it for 20 years. Is it surveys that you're going to be filling out, or how will they track these people?
Sure. As a part of a follow-up, they will be doing brief questionnaires for follow-up, and those brief questionnaires will sometimes assess their waist again, sometimes will assess their blood again. We'll really be asking just questions about what's been changing in their lifestyle over the last 30 to 40 years.
Okay, and you said it's people, is it people between the ages of 35 and 65? Do you have to have had cancer, or are they looking for people who've not had any type of cancer?
Good point. Actually, this patient should not have cancer, and it's between the ages of 30 and 65, and he should not have cancer. So no personal history of cancer. You can have a family history of cancer, but not a personal history of cancer.
Okay. So you had mentioned earlier in the show, one of the things that they found with esophageal cancer had to do with expanding waistlines. Was that one of the outcomes of the previous cancer study?
Correct. So correlating obesity with cancer has been correlated with breast cancer and obesity, now with esophageal cancer and obesity, stomach cancer and obesity, colon cancer and obesity. So we're able to make some correlations with a person's diet, waist, and weight, and make that correlation.
Okay. We've just got a few more minutes here. What are some things that we need to be keeping in mind? You know, sometimes you may not be able to prevent cancer. There are a lot of things we can do to prevent it. But can you talk about some of those lifestyle choices that we can be making now?
Sure. I think the biggest one is diet and exercise. As my Most Being Well shows, I point out that breast cancer and prostate cancer has been directly related to a person's diet. So the initial thing that I tell patients when I see them specifically for breast cancer is, have your weight for your normal height. So based on your height, you should have an X amount of weight. So that's the biggest thing I'd point out to a patient. The second thing is smoking and alcohol. We do know that it was in vogue, 30 years ago, but hopefully with our generation and future generations, it's going to become out of vogue. So changing that lifestyle of smoking abuse is there. Lastly, alcohol abuse is a big issue that I've seen come about with the development of these cancers. It seems like drinking, but drinking to an extensive amount, has been developed in our younger generation, and it's kind of trickling down into as they get older. But I think the most important thing to point out with patients is close follow-up with your physician and getting these preventative studies done. That would be the best help to prevent cancer in the future for them.
All right. Well, Dr. Shakir, thank you for stopping by at
Thank
Issue
you.
today. We'll probably have you back on our other show, Being Well, at
Sure.
some point. And as a reminder, if you have an idea for our show, we'd love to hear from you. Just email us at weiu@weiu.net. And you can also watch all of our At Issue programs online at youtube.com/WEIU TV. Thanks for joining us this week for At Issue. I'm your host, Lori Casey.